Well, kicked off and now sounding off. What if your health plan is canceled and you have to fork over nearly twice as much for a similar one? Sound like a nightmare? Well, it's Linda DeRight's reality. And rising costs only some of what really worries her right now. Linda, thank you very much for coming. What happened? Tell me what you discovered.
Well, Neil, I don't think we're unique. Back in September, we received our letter. I think now in the state of Washington, we're up to 290,000 of us that canceled our 25-year policy with an insurance company that we were really happy with. And our monthly premium of $642 is now going to be $1,050. And I think the secret that we've found out after days and days and days of looking into this is how narrow the networks and the benefits have become. So that's what happened to us. And we've been to the exchange. My husband and I we decided when we heard we were going to be on your show, tried to calculate how much time we've spent on this issue. And we think we put in 5 8-hour days on trying to figure out what to do about our health insurance.
You can go into the consulting business on it. It sounds like you're promising. Yeah. Well, so your plan, obviously, they told you, look, whatever you had, it's going to cost you more, or they dumped you outright and led you to another plan that would cost a lot more. What exactly happened? Well,
they told us, as probably most insurance companies, for people like us who have these, which I really resent being termed this, so-called garbage plans. Our garbage plan has served us really well for 25 years. They mapped us to another plan. But those plans, when we looked further, are so incredibly narrow in terms of providers and benefits. And for us, we're 32-year residents and 25-year of Seattle and 25-year participants in this healthcare policy, and we were losing all our providers. So that's, I think, what I found to be the dirty little lie about Obamacare.
So if you want to keep your doctor, you want to keep your coverage, and you're so fortunate to be able to do so, you seem to be saying it's just going to cost you a lot more.
You can't. You can't. On the plan we were mapped to by the insurance company, we can't. On the exchange, out of the 38 plans, and we have a state exchange, and our exchange is being held up now as an example for the country. Out of the 38 plans, we only found one where we had an expanded provider network, and I think that's the one we're going to go to, because at age 59, we've had some doctors for 30 years who know us. We've had a lot of, we're fairly healthy, but we've had a couple issues along the way that our plan really was fine for us. So our new policy, if we take it off the exchange, is going to be $1148 a month for two people, two 58-year-olds in seemingly good health with a couple of just middle-age issues.
Incredible. Incredible.
It is incredible. It is incredible. So we didn't get to keep, if you bought what Obama was saying, no one can really keep their doctor unless you're willing to pay this exorbitant amount. You cannot keep your doctor. In fact, what I found through the exchanges is that, well, the contracts, actually this is interesting, in the state of Washington, until about 2 weeks ago, the contracts hadn't been finalized. So we ended up calling all the places we've been for health care, our local hospitals and the doctors through the hospitals that we're affiliated with, and ask them who they had contracts with. They're the only people who steered us where we are, because there's not information on the exchange.
Amazing.
They hadn't finalized their list of providers yet.
Linda?
So I would give anyone who's looking to figure the exchanges out to call their providers and find out who they have contracts with. That's a good place to start.
Thank you for that. And again, I just want to remind folks before we close out here, this is not the exception. This is not some aberrant event. These are not some unique situations. This is the healthcare law unrolling in America. More to this.